It's Wednesday. For the last 30 years, I should say at this time, certainly we've had the opportunity to talk sports medicine and about our greater Akron area with my good friend, Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. Let's bring him in. Dr. Joe, what do you have for us this morning?
Yeah, Ray, let's not talk weather. Let's talk sports.
Yes,
there were
please.
a lot of really interesting football games and things, and the head scratcher of the week that everybody's asking me about. That's a lot of times how I review these cases of what goes on, is everybody's asking about this really very good-looking young quarterback by the name of Bo Nix. He's got his team a couple games, one game away from the Super Bowl, and it's kind of a surprise team, the Denver Broncos. He's done really well, but the head-scratcher part of it is he played in a very physical game. He was all over the field and took some big hits and everything else, and then an hour after the game, they tell us that he had a significant injury. And in reviewing the last few plays, he had one play where he rolled out, really didn't look like he took much of a hit. The second last play, he was just taking a knee to set up the field goal, and maybe his ankle got tangled up under him a little bit, but nothing really significant. And then we're told that he has what's called an unstable fracture. It's not going to heal on its own. That's what unstable means. It may be displaced. It may be out of alignment. It may be on both sides of the ankle. They really have been pretty tight-lipped about exactly what the ankle injury is, other than it was unstable and it needed surgery. And he had surgery yesterday down in Alabama. A lot of people talking about the malleoli are these bumps on either side of the ankle, and that's often where fractures are, and it could even have been people talking about both sides of the ankle, so a more significant fracture. But with hardware and surgery, and he should do pretty well, but it's going to take all of several months probably for him to do well after yesterday's surgery and season-ending surgery. But more of the details then come out when you look at the story a little bit more. And I probably have looked at 6 or 8 articles about this. And the story is, the biggest part of the story is the details are that in 2021 he had a pretty significant ankle fracture on the right ankle when he was playing at Auburn University. And it was unstable also, and he needed surgery and time off and rehab to get better from that pretty significant right ankle surgery. And again, a year ago now, in January of 2025, he had a cleanup surgery. He had some discomfort and pain through the 2024 season, and so that tells you there probably was some debris or leftover injury from the bad fracture in 2021, and he had surgery a year ago. But he played all the way through this season, and again, not very much that you saw on the field to say, wow, that would be a significant fracture. But it goes back to one of the orthopedists that I learned from and dealt with, and the saying goes, the greatest predictor of future injury is past injury. So I'll say it again, the greatest predictor of future injury is past injury, and so probably some significant injury that he had that predisposed him to having a surgery again, and a very heartbreaking for the kid as he gets to the pinnacle probably of his career, getting close to the Super Bowl. What happens is many athletes have baggage, I call it, previous injuries that they carry around. Thankfully, in the career I chose, being in pediatric sports medicine, there's not quite as much of that. 10 to 20% of kids maybe have old injury issues that they still carry around with them. When we get to college, that number probably doubles. It's probably up around 30 or 35, 40% maybe have old injuries. When we get to the professional level, many of my friends tell me it's over 50% of people have some of these in football, basketball, baseball, old injuries that they carry around. And that's why the Combine, which is coming up later this month, where they try to pick NFL players, is such a big deal. Every team that goes to Indianapolis brings their own X-ray, MRI, CT, CAT scan units, because they study these old injuries in so much detail. it's worth lots and lots, millions of dollars and draft picks and everything else. So at the Combine, they have the chance to look at these injuries and try to assess them. They don't share data between teams. Is this the kind of injury that could rear its ugly head again, or that could be a problem later, or not a big deal? And so they study these. Now, we don't have that luxury in high school, do we? Or in college, even, in many cases. To some extent in college, but not in high school. But a lot of coaches that are kind of in the know in high school will ask kids if they've had previous injuries that were fairly significant, perhaps needing surgery or missed a lot of time. They will ask them and encourage players, hey, you really ought to see somebody from sports medicine perhaps who would assess that injury, maybe put together a prevention plan for you, or try to be ready for what types of injuries could come down the road from the previous injuries that you had. And so that does go on even in the high school and certainly the college level, but it's big business at the pro level at the Combine. And so yesterday down at the James Andrews Clinic, he's the famous longtime surgeon, and down at the Andrews Clinic in Alabama, the surgery was done on Bo Nix's ankle yesterday. And that clinic kind of had its beginnings with a gentleman by the name of Jack Houston, a famous sports medicine doctor. And I've been so blessed in my career, I would be remiss if I didn't say I got to go to the Houston Clinic with Jack Houston as he retired in 1987. And he spent a lot of time with me teaching so much. I don't know why I've been so blessed in my career, but I went down outside of Auburn, Alabama, took care of Auburn for a little while with the team that they had there. And he taught me so much as a part of my training in the year 1987. And now athletes still go down there. It's really called the Quarterback Clinic, where Bo Nix went down in Alabama, where James Andrews Clinic is. So anyway, the greatest predictor of future injury is past injury, Ray.
Unbelievable. And you always stress that, too. And, you know, you mentioned the cleanup and the past injury and such. Joe, what about going forward with Bo Nix? I mean, he's a young, exciting quarterback. I know you can't rub the crystal ball, but with now 2 big breaks here in the ankle, from a sports medicine perspective, what do you see? I mean, is it going to be troublesome for him?
Yeah, it's you know, that's you always get right to the point of the question. That's really what everybody is asking, and it is a couple of points about it. First of all, you know, a lot of people share a lot of information, like what bone was it and where was it. They did not share a lot of information, so it's without a lot of information that I say this. But the ankle is a joint that's pretty reasonable in being able to stabilize versus the knee and the shoulder sometimes, and so people do pretty well with most ankle injuries, barring anything really unusual going on. But it will be all of, you know, people were talking after yesterday's surgery 6 to 8 months, but he should do real well, and they should be able to stabilize that ankle. And I expect him to get back to his career. Ankles are not usually the worst joint for getting back toward normal. And my thoughts with him is, I think after he rehabilitates, being ready, I think he'll play next season some, from just looking in from the outside and not knowing the details, and I think he'll get back for next season. But it is a big road ahead of him and big surgery, and of course we don't know how it went yesterday, but assume in the hands of the best surgeons in the country that he got that ankle stabilized yesterday, and he'll go back on to a great career.
All right. Great information, Joe. Thank you so much. And good information. I know we were all surprised when we saw broken ankle. What's going on? And now we know a little bit more of it. Thanks, Joe.
Thanks, Ray. Have a great week.
You too, my friend. There you go. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. Great visit again with us this morning here at WAKR.